everyone. You're welcome to Nurse Coach Ola Health and Career Consulting. My name is Ola Inkaremu, and today I'm going to be talking about a very important topic that you are aware of, be it, but just to give you an update of what is happening. And it's no other thing than the COVID-19. You know, I was so excited, like I was getting excited and people getting excited that this thing is going off and this thing is, going away gradually, and then we're getting back into the usual life. But then if you look at the statistics now, if you hear the news, you'll know that the COVID-19 is already, it's coming up again. So I've got a report this morning, which is one of the reasons why I'm doing this video, that actually kind of caught my attention. It's the reason why we have to do this video, and people have to be more aware. You know that there have been a recent increase in the rates of COVID-19 diagnosis in the hospitals. Speaking from Ireland as a country point of view now, yesterday the department was notified of 1,571 further coronavirus cases. And there are about 307 people with the virus being treated in the hospital, which is now down on 11 from yesterday. That's from the other day now. The number of COVID-19 patients in ICU stand at 55, down 5. So in a way, people need to be aware. We need to be aware that coronavirus is still out there, and we should not, because we are fully vaccinated or you've had one dose and then you feel like you can just do whatever you like. So we still need to be aware of and to, work with the government to go with the public health safety guidelines. Now, I'm tagging this as waning protections. Like, I know the COVID-19 vaccines have been said that to wane after a period of time. I found this article that's yesterday as well, this morning. I'm just going to share with you there. It's really something we need to be mindful of, because you have a COVID vaccine, because you are fully vaccinated, that does not give you that's 100% assurance, or like you can do as you like. So we know that it was said that even the COVID-19 vaccine does not provide 100% effectiveness or protection against the coronavirus. So let's see about what's the duration, how much protection does this give to people. So I found this as well. I'm going to be sharing. This is from CDC. This is from CDC that I was talking about the level of protection offered by the COVID-19 vaccine, the different types of COVID-19 vaccine, and how long, so let me just check that here now. If you're just joining me, this is Ola Inkaremu, and this is just your health clinic. We're just going to be talking about some health updates, what we need to be aware of, about COVID-19, about our health generally, things around us. So as your health information coach, I'll be bringing you up-to-date information about how to stay healthy, how to age well, and so on and so forth. So let me go back to what I was checking here. The FDA, yes, this is from the journal.ie. It said COVID, Pfizer, and AstraZeneca vaccine protection reduces after 6 months, study suggests. So there's a waning effect of the COVID-19 vaccine. Waning protection is to be expected, and it's not a reason to not get vaccinated. So the quick thing I'm going to be talking about, like 4 subheadings today. First of all, is for those that are not yet vaccinated, especially for healthcare workers. So at this moment, I know we have the right to make a choice. We have a right to, decide what we want. But we really, really implore everyone at this point in time, if you're a healthcare worker, please go and get your vaccine. Go and get your vaccine. We know that it does not automatically give you 100% protection, but then what the COVID-19 vaccine does is that it prevents severe illness, hospitalization, and death as a result of coronavirus, even against the widely circulating Delta variant. So, however, we know that the research has shown that Delta variants, that the experts have seen reduced protection against mild and severe diseases that is accompanied with Delta variant. For that reason, the US government, they're planning a booster shot, so vaccinated people can maintain protection over the coming months. So, like I said, I'm going to be sharing with you how many months, that we can expect protection from some of the different types of vaccine. But before then, let me go ahead with this report again from the journal.ie. It says that the Pfizer jab was 88% effective at preventing COVID-19 infection a month after the second dose. All right. Let me go to that again. The Pfizer jab, that's the Pfizer vaccine, 88% effective at preventing COVID-19 infection if a month after the second dose. But after 5 to 6 months, the protection decreased to 74%, suggesting protection fell 14 percentage points in 4 months. So this is trying to tell you that even though you are vaccinated, fully vaccinated, I've seen a lot of pictures, video, and people say, "Oh, I'm fully vaccinated. I can go. I can, travel. I can do it." We still need to take precautions. It is very important. Take precautions. Follow the public health guidelines, and so on and so forth. Okay. Now I'll continue again. That is for the Pfizer. Now with AstraZeneca vaccine, there was a protection against infection of 77% 1 month after the second dose. After 4 to 5 month protection decreased to 67%. Oh my God, I took the AstraZeneca. So does that mean that I only have 7% protection from the COVID-19 virus? So we need to look at it. When was the last time? Check your vaccine certificate. Check it there. When did you get the vaccine? When did you complete your, the second dose? So you can know like how to, be extra careful over time. The study drew on more than 1.2 million test results and participants. So what we're trying to say in essence is that the COVID-19 vaccine is not an automatic protection, does not give you automatic protection. You still need to protect yourself, follow the public health guidelines. We had cases of people that actually were vaccinated, fully vaccinated, but still get coronavirus. But what the vaccine does is that it reduces, the effects of the virus. It reduces the possibility of people dying as a result of coronavirus. So that is the essence. That's the more reason why you should get the COVID-19 vaccine. So if you haven't gotten your own jab, go ahead and get your jab. You can go to the nearest pharmacy. You can book at HSC if you're in Ireland or whichever country you have. Just follow your, your country policy and make sure that you get vaccinated. But then, like I said, fully vaccination also does not give you the liberty, so to say, to break the rules, to go against the public health guidelines. We still need to follow this. So just for you to know that COVID-19 vaccine protection wanes over months, 5, 6 months. Now, the question is that people ask, and I've seen as well on websites and all that, do we need a booster? Are we going to need a booster? So there has been these questions everywhere about people getting the booster. When are we going to get a booster? So from the cdc.gov website, I've gotten this information. I'm sharing with you now. There's a question there, where can I get a COVID-19 vaccine booster? So it's not an immediate thing. The goal is for people to start receiving a COVID-19 booster shot beginning in the fall, with individuals being eligible starting 8 months after they have received the second dose. So 8 months after you have received your second dose, this is still under consideration, actually. So you can start to think of getting a COVID-19 booster dose. So you might want to put that in your diary and, check the time where you had your COVID-19, your second dose, and then you can estimate when you may need a booster. Okay. So the other question is, who will be the first people to get a booster dose? So if the FDA authorizes and recommends a booster dose, which, like I said, is still under consideration, the first people eligible for a booster dose will be those who were the first to receive the COVID-19 vaccination, as those who are the most at risk. So they're still going to do the risk assessment, and this will include healthcare providers, residents of long-term care facilities where I work, and other older adults. So And remember that we were the one, like the first set of people that got the COVID-19 vaccine in the first place. So it's going to be in that order as well. That is, if it's recommended. All right, so we should just know that COVID-19 constantly evolves. There are different, we know there are different variants that are becoming, the Delta variant, the Alpha, the Beta, and all the like. So if the vaccine will only be more effective based on research, as new variants come out, then they have to work ahead and see what can we do again, how can we make this booster work, right? So if the FDA authorizes and the ACIP, which are the organizations responsible for this, if they recommend it, the goal is for people to start receiving a COVID-19 booster shot by fall. So we should start expecting that. Okay. The other question is, will people who received Johnson & Johnson's COVID-19 vaccine need a booster shot? So the response is, it is likely that people who receive the J&J COVID-19 vaccine will need a booster dose, because the J&J Janssen vaccine wasn't given in the United States until 70 days after the first the mRNA vaccine doses for the Pfizer and the Moderna. So if your vaccine was the J&J, that's the Johnson & Johnson vaccine, you will definitely need a booster dose if it's recommended. All right, so the last question there is, if we need a booster dose, does that mean that the vaccine aren't working? No, that doesn't mean that the vaccines are not working. COVID-19 vaccines are working very well to prevent severe illness, hospitalization, and deaths, even against the widely circulating Delta variant. But, for that reason, it is important that you get your vaccine, and then you still need a booster dose, because, like I said, the protection wanes over the months. Okay, so that will be all. Just an update for you there about the COVID-19 vaccine. I'm going to give a recap. If you're out there, if you're a healthcare worker, now I think between the age 12 and 25 are out there getting the vaccine, please go and get your full jab. Get your full jab. Let me tell you something again. I read in the news, independent.ie, about, for healthcare workers, especially those that are working with agencies. Okay, so if you are not fully vaccinated, if you don't have your COVID certificate now, you might not be able to get an agency job. So, and that is because measures are being taken, organizations are taking measures, hospitals are taking measures, to protect their residents, to protect themselves. So protect yourself, protect your family, your loved ones by getting vaccination. All right. Thank you again. Till we meet next time. It's Olayinka Aremu. I'll see you later. Bye for now.